Hello, I'm Dr. Robert Kaufmann, and we're about to go
beyond the terminus.
Today we're talking about posts and when to use them. Posts and post-use are probably the most misunderstood part of restorative dentistry. Well, what does the literature say? The general consensus is that posts are used only for one thing, and that is to retain cores when there's insufficient coronal tooth structure to do so. In almost all cases, with judicious preservation of dentin, proper choice of materials, and good retentive core design, you almost never need a post unless the tooth is flush off close to the gingival line. Even then, the retentiveness of your crown will largely be determined by ferrule, not by a post. Relying upon a post to retain a crown by itself is a recipe for fracture. Prefab metal posts used in this way will usually snap off at the level of the natural tooth. Cast posts generally either lose their cement bond or result in catastrophic root fracture. Posts, especially metallic posts, do not strengthen teeth. Shaping the canal to accommodate cast posts to allow for draw, or using something like a parapost drill to increase the parallelism for prefab posts, results in loss of dentin. And that's never a good thing. I won't discuss screw posts because they're so aptly named. There's no excuse for using them ever. There is some evidence in the literature to suggest that fiberglass posts can strengthen teeth in selected cases, such as anterior teeth with severe resorption. The problem with this is the bonding technology we use to try to bond the post to the dentin. Unlike enamel bonding, we know that C factors, trying to bond to dentin, and long-term solubility of bonds and bonding in poorly accessible areas create some real challenges. Endodontists don't like posts. They don't like what they can potentially do to dentin and how they obstruct canals when the teeth need retreatment. A Panavia cemented cast post in an anterior tooth can be very difficult to remove. Having said that, I'm constantly amazed at how and why clinicians insist on using posts in situations where they're totally unnecessary. I guess in the best case scenario, it can be blamed on ignorance. In the worst case scenario, it's simply greed. You get paid to put one in the canal. Most insurance plans cover them, and it's easy. The problems arise when the endodontic cases need to be retreated due to symptoms or presence of periapical pathology. These posts have to be removed, and dentin often has to be sacrificed to remove them. Most prefab metal posts can be removed fairly easily with a judicious use of wet ultrasonics and a bit of time. More stubborn cases require a dedicated post removal device, such as the Ruddle or Gonon post removers. In rare cases, they must be drilled out, which should only be attempted with water spray under scope magnification. So, before you reach for a post, look at the case more closely. How much of the post is actually engaged with the core and the tooth? How much of the post engages in the dentin of the actual canal space? Is it really necessary? Is it nothing more than an intradental implant? By removing all of the original restoration and some of the gutta percha in the orifices, could you create enough retention for your core material? If so, don't use a post. If you must use a post, always use a rubber dam to place them. What is the point in trying to maintain canal asepsis during treatment only to have it compromised because it wasn't used during post placement? When you do refer a case to an endodontist, ask them to prepare some retention spaces in the canals for you after the endodontics is performed. Better still, why not have the endodontist place the core for you? On completion of the endodontics, the dam is still on, the canal spaces are sterile, with ideal moisture control, visibility, and isolation. You'll never prepare a faster crown than after your endodontist has placed the core for you, and all you have to do is cut the prep. Remember, when we do the right thing, our patients get better, but so do we. Thanks for listening. Join me again when we take another trip beyond the terminus.